What is an opioid? A powerful, highly addictive narcotic commonly prescribed to treat pain. Some well-known opioids include codeine, Demerol, fentanyl, oxycodone, Percocet, and Vicodin. Opioids are among the world's oldest known drugs. Putting opioids into perspective, more than 72,000 people in the US died from drug overdoses, nearly 200 a day. That's up from 2016, which held the previous record of roughly 64,000. Two-thirds were linked to opioids. It would have killed more people than guns, car crashes, HIV and AIDS in a single year. More than 62,000 soldiers have died in the Vietnam and the Iraq War, still less than the 72,000 who died in the US from opioids. While the US makes up 4.6% of the world's population, it consumes 81% of the world's oxycodone supply. We know that 4 out of 5 heroin users started with a prescription drug. It could be for wisdom teeth, sports, or other injuries. So this is why it is so important to focus on our youth as well. So what could have caused this drug crisis? Illicit drug use in the US has historically increased. In 2017, 25 million Americans abused drugs. User demand for more and stronger drugs only continues to increase. Synthetic opioids such as fentanyl are the latest and growing drug demand. Fairfield County stands for 2018. We had 1 total drug overdose death. We had 13 opioid-related overdoses, 35 patients with an opioid use disorder, and 835 opioid prescriptions were dispensed in Fairfield County. South Carolina opioid-related deaths. In 2014, we had 508 opioid-related deaths in South Carolina. In 2015, we saw an 11% increase. In 2016, we saw a 9% increase. In 2017, we saw a 21% increase. And in 2018, we saw a 9% increase. Narcan administration counts by county for 2015 and 2016. If you look on the graph to the left, we see Fairfield County was responsible for 49 Narcan administrations. And in 2016, only 47, so we did see a decrease. Signs someone is abusing prescription drugs. Symptoms of prescription drug abuse can be hard to recognize in older adults. This is because they are similar to symptoms for aging. For instance, confusion and memory loss are symptoms of both. If you care for or spend time with an older adult, be aware of their medicines and behavior. The following are warning signs that someone may be abusing prescription drugs. They include appearing confused or forgetful, often talking about a medicine, are afraid to go somewhere without taking the medicine, are defensive when you ask about a medicine, make excuses for why they may need the medicine, get a prescription for the same medicine from 2 different doctors, fill a prescription for the same medicine at 2 different pharmacies, become more withdrawn and angry, take the medicine at different times or more often than is instructed on the label, take more of a medicine than they used to, or take more than is instructed on the label. Signs of someone really high. Muscles will become relaxed, slow movement and reaction times, speech is slurred, sleepy looking but will respond to stimulation, and then nodding. Opioids to heroin. 75% of heroin users got started with prescription drugs because they are cheaper and easier to access. The cost of heroin continues to drop while potency levels rise. A baggie, or a small single-use bag of heroin, typically costs between $5 and $20. In 2016, the United Nations Office on Drugs and Crime reported the average price of heroin in the US was $152 per gram, which is usually divided into 20 bags. People with severe heroin addictions have described purchasing 10 to 15 bags of the drug per day. Following this model of use, an individual would spend between $438 and $1,700 per week. Vicodin costs about $126 for 100 pills. Without insurance, that's about $1.26 per tablet. The same single pill costs $5 on the street, almost 4 times more. High prescription and street prices for these type of pills often lead people to search for cheaper alternatives, such as heroin or fentanyl. Because opioid addiction requires higher and higher amounts to get the same effect, an individual would need to take progressively higher number of pills each day, which can lead to addiction. Fentanyl is used to treat severe pain. It is 50 to 100 times more powerful than morphine, and it is a threat to anyone who comes in contact with it, not just users. 0.25 milligrams can kill you. So if you look on this picture on the right, we see 3 little containers. One has carfentanil, one has fentanyl, one has heroin. You can compare the carfentanil to 1 grain of salt. You can compare the fentanyl to 15 grains of salt, and you can compare the heroin to about 50 to 75 grains of salt. These are all fatal doses. Here we have a fentanyl video that you can refer to in your spare time, and it will kind of reiterate what we talked about with fentanyl. Some safe storage tips. 1, lock them up. 2, keep the opioids in a pharmacy bottle. 3, always secure after use. 4, keep track of quantities. And 5, remove unwanted drugs from your home. What are some risk factors for overdose? Mixing drugs and reducing tolerance. Using an opioid, such as heroin, fentanyl, with alcohol, crack, cocaine, or other substances, increases the risk of an overdose. Repeated use of the same drug leads to an increased tolerance of its effects on your body. If you were to take a break from a drug, your tolerance is lower. A reason you might take a break will include sickness, hospitalization, or treatment. Some other risk factors for overdose include unfamiliar supply or changes in quality. So if you were to get a new drug dealer, or if your dealer gets a new supply, it may be of a different strength than what your body is used to. Having someone else inject you is also a risk factor. If you are relying on someone else to inject you, then they are in control of your dose. Physical health is also another risk factor. Your liver functioning, your weight loss, asthma, immune system problems, dehydration, malnutrition. And then using alone is also another risk factor. Though using alone does not increase the potential for overdose, it means that no one is around to help you if something does happen. All opioid drugs depress the central nervous system. This results in decreased blood pressure, breathing, heart rate, and temperature. During overdose, these critical life support functions slow even more, to the point where they begin to shut down. Left untreated, these circumstances can lead to death. And if you want to find out any other information on opioids, our fight against the opioid epidemic, please visit justplainkillers.com. Now next we have Mr. Douglas Johnson.
Naloxone is a medication that can treat an opioid overdose when given right away. It rapidly restores normal respiration to a person who has stopped breathing as a result of overdosing on prescription opioids or heroin. It works by rapidly binding to opioid receptors and blocking the effects of opioid drugs. Some states have passed laws that allow pharmacists to dispense naloxone without a personal prescription. This allows friends, families, and others in the community to use the nasal spray versions of naloxone to save someone who's overdosing. Fairfield Behavioral Health now offers this medication to patients and caregivers in case their loved ones overdoses on different drugs. The Joint Protocol authorizes any pharmacist practicing in the state of South Carolina, licensed by the South Carolina Board of Pharmacy, to dispense naloxone hydrochloride products to persons with a prescription pursuant to the South Carolina Code of Law. In December of 2017, the governor declared a public health emergency in South Carolina regarding our opioid crisis, and 2 executive orders were declared by the governor. 1, establish an opioid emergency response team to draft a final report to recommend ways we can work to address the epidemic crisis in our state. 2 was to direct the Department of Health and Human Services to limit the initial opioid prescriptions for acute and post-operative pain to a maximum of 5 days per state Medicaid recipient. South Carolina Community Distribution Law. This law was enacted in May of 2018. The law authorizes the designation of public and or private entities as community distributors of Narcan. It authorizes a prescriber practicing in the state of South Carolina and licensed by the South Carolina Board of Medical Examiners or the South Carolina Board of Nursing to directly or by standing order prescribe the following naloxone hydrochloride products to a community distributor as described, as well as pharmacists licensed by the South Carolina Board of Pharmacies to dispense the following naloxone hydrochloride products to a community distributor pursuant to a prescription or a standing order. South Carolina Overdose Prevention Act. This act seeks to grant immunity from both civil and criminal prosecution to doctors, pharmacists, caregivers, and first responders who are engaged in the prescription and administration of Narcan in an opioid overdose suspected case. A caregiver may, in an emergency, administer an opioid antidote to a person whom a caregiver believes in good faith is experiencing an opioid overdose if the caregiver has received the opioid overdose information. A caregiver who administers an opioid antidote in accordance with the provisions of this section is not subject to civil or criminal liability. The Good Samaritan Law provides criminal immunity to a person who calls the police or 911 to assist someone who is overdosing in an effort to save their life. 5 essential steps for lay first responders. Step 1 will be to check for signs of an opioid overdose. Signs of over-medication, which may progress to an overdose, includes unusual sleepiness, drowsiness despite loud verbal stimulus or sternal rub, mental confusion or slurred speech, slow or shallow breathing, slow heartbeat and or low blood pressure, and difficulty in waking the person from sleep. Signs of an opioid overdose which can result in death includes unresponsive to shouting or pain stimulation, problems breathing or deep snoring, blue, purple, or gray face, especially around the lips and fingernails, pale, clammy skin or loss of color, extremely small pinpoint pupils, and then slow heartbeat and or low blood pressure. This image shows what blue fingernails and lips could look like in an overdose case. Sternal rub is something we do to patients with a decreased level of consciousness to see if they respond to pain. It consists of taking the fist and applying firm, direct, rotating pressure with the knuckles of one hand over the sternum. Step 2 will be to support the person's breathing. For a person whose breathing is severely impaired, rescue breathing is one of the most important steps in preventing an overdose death. Steps for rescue breaths include check for cleared airway, place one hand on the person's chin, tilt the head back and pinch the nose closed, place your mouth over the person's mouth to make a seal and give 2 slow breaths. The person's chest should rise, but not the stomach. And then follow up with 1 breath every 5 seconds. Step 3 will be to dial 911 immediately. It is important that EMS be there for the patient as soon as possible. If someone else is also on the scene with first responder, have them dial 911 while you administer Narcan. Make sure you tell dispatch that someone is unresponsive and not breathing. Ask them to bring additional Narcan. Give the address of the location or a description of your location. Step 4 will be to administer the Narcan. First, you peel back the package to remove the device. Hold the Narcan nasal spray with your thumb on the plunger and your index and middle fingers on either side of the nozzle. Be careful not to prime or pump the device. This will cause you to waste the medication. Tilt the patient's head back, supporting the neck with your hand. Place the tip of the nozzle in either nostril until your fingers touch the bottom of the patient's nose. And then press the plunger firmly to release the dose into the patient's nose. Step 5 will be to monitor the person's response. Spontaneous breathing usually begins within 3 to 5 minutes of the naloxone administration. Naloxone only continues to work for 30 to 90 minutes, and overdose symptoms may return. Important that the person gets to the emergency department as soon as possible after they have been revived. All patients should be monitored for reoccurrence of signs and symptoms for at least 4 hours from the last dose of naloxone. The recovery position. If person is breathing, turn person onto their side as seen in the picture. This position will help prevent the person from potentially inhaling vomit. A recap of do's and don'ts in responding to an opioid overdose. Do support the person's breathing by administering oxygen or performing rescue breathing. Do administer naloxone. Do put the person in the recovery position on the side if he or she is breathing independently. Do stay with the person and keep him or her warm until EMS arrives. Do not slap or try to forcefully stimulate the person. Do not put the person in a cold bath or shower. Do not inject the person with any substance. And do not try to make the person vomit drugs that he or she may have swallowed. In addition to this presentation, I have provided you with the link to the Narcan Adapt training video for you to review. Thank you.